The incision is made slightly caudal to the umbilicus and the fat cut away because it improves exposure of the linea alba, stops the subcutaneous fat from getting caught in the ovarian clamp, helps with closure, as the fat and muscle layer are separated. Remember, the uterus runs parallel to the vertebrae, is more tubular than intestines, which are flatter. Size can vary greatly, and the uterus tends to be lower down closer to the vertebrae. On your next cat spay, palpate colon R, and you should feel the uterine horns flick under your fingers. This should help with orientation regards finding them. Generally, in young dogs, the uterus is just low down parallel to the vertebrae, but in older dogs, can be higher up. Everyone eventually gets the knack of finding the uterus. It is more with poor ovarian ligations where vets can fail. You must break the suspensory. The further down and closer to the rib insertion, the safer is the process. Do not use the guitar strumming technique, as this is where it can go wrong, as the suspensory can break close to the ovary, resulting in bleeding. And also remember to keep the renal ligament intact. I have seen too many vets turn an easy spay to a difficult by damaging the ovarian vessels. When making the window in the broad ligament, stay away from these vessels and use a translucent area. Don't let other vets put you off the uterine separation technique because they don't understand it. Get them to watch the video. I have had messages from vets who were flying through their bitch spays and then they were made to do the 3 clamp. It all started going wrong again, and eventually the boss let them use this technique. And their most recent message was, they just flew through another 40 spays because of this technique. Remember, loosely form the millers, push down and tighten. Rotating the clamp can help keep the ligature in the lower position. Hold the ovary, move the clamp down and repeat the millers. Now release the clamps and check for bleeding. This is a much better position than holding on to the ovarian pedicle by a thread. And discover a bleed and then try and raise the pedicle to reclamp. With this technique, we can easily reclamp and ligate again. Keep the uterine vessel with the uterus and make the window in a translucent area. Then clamp and ligate the broad ligament. Push down, don't pull up, to get the ovary. Once you have the ovary, it is protected by the ligaments, so can be held with some force. Hold with tension in right hand, slide left index deep to insertion, to break suspensory. As this side is thicker, can break in 2 pieces, or hook under and push up. Make a safe window through the broad ligament. Walk the ovarian clamp down, while holding the ovary taut. Separate the uterus and place a Miller's and then raise the clamp and apply second Miller's. Remove clamps and check for bleeding and clearance of the ovary. Reapply clamps and remove ovary. Now the broad ligament for this side. The reason for doing this is to increase exposure and reduce the amount of fat in uterine ligations. So with this uterus, I opted for a surgeon's first, as this ligation is least likely to cheese wire the uterus. I then followed with a Miller's, and then I used a transfixer instead of the second Miller's. I never use crush beds. I have had dogs where the clamp ripped the uterus in half. The transfixed is for the uterine vessel. As I pass the needle, I keep it central. The needle has 2 long tails. Once through the uterus, I cut the needle out. And one piece of suture is for one side and the other for the other side. Clamp and cut the uterus away. Avoid leaving crush beds inside the dog. Occasionally, a vessel will not bleed, as it is trapped over the muscle, and then once released can start bleeding. So check for bleeding after initial cut and then again once nudged back in. The muscle fat and skin are then closed.